Hi folks, my name is David Villar and welcome to this presentation on clinical effects of meloxicam. A little bit about my background. I'm originally from Spain. I did my Master's of Science at the University of Illinois and then moved on to Scotland and did my PhD at the University of Aberdeen. And then I moved on to Iowa and did my residency in toxicology at Iowa State University. And now have been working for almost 12 years at the University of Antioquia in Colombia, and I teach pharmacology here. So, in your future careers as veterinarians, I bet you $100, and believe me, you don't want to do so because you'll probably lose. But you will use this veterinary drug handbook to look up for information when you need to prescribe drugs. And you may wonder, where the heck do they come up with those dosages and intervals? Well, this is what we're going to see here in some of these videos. All the information in these drug handbooks come from the type of studies that we're going to see here. And the other reason why we choose to talk about non-steroidal anti-inflammatories is because after antimicrobials, they're probably the second group of drugs that will most frequently be used in practice. So the sooner you become acquainted with them, probably the better. They're crucial to control pain. Nobody, including animals, like to be in pain. And this will be probably a good start to see the different clinical effects of these important categories of drugs. So before I start with the specifics of the study, it's important to remind what are the main signs of inflammation, because as we will see, these are the things that will be evaluated in the clinical effects of the anti-inflammatory drugs. There are five cardinal signs of inflammations, which are heat, redness, pain, swelling or edema, and loss of function. And these are basically a reflection of the changes that are taking place in the local blood vessels as they're written here. And the idea or purpose of this inflammatory process is basically to allow the body to defend itself from any invading organism, and basically to promote the repair of injured tissues. When the body is able to repel the insult and restore the damage in acute inflammations, you basically get a complete resolution and repair if those tissues are capable of regenerating. However, if the distraction is too severe or the insult tends to persist, then the inflammation becomes chronic, and then the normal tissues tend to be replaced with the scar tissue, and usually there is a loss of function. So what triggers the inflammatory response? Well, basically the state of inflammation is set up when the tissues are physically damaged, or there are pathogens that are recognized by, say, white blood cells. And either way, they're going to be released what are called inflammatory mediators, which cause the inflammatory response. For example, there are macrophages and neutrophils that can secrete prostaglandins and leukotrienes from the degraded membrane phospholipids. And these are produced really rapidly when there is an injury. And what we see here is just the beginning of what could be a cascade of many other mediators that come later, and I will not really get into here. But as you can see here, the non-steroidal anti-inflammatories block the enzyme cyclooxygenase, which converts the arachidonic acid into prostaglandins. And these prostaglandins are, as I say, just one of many mediators, and as I say, there are many others. For example, if you were to have an allergy, which is a type of inflammation, and you were to take an aspirin or acetaminophen, it will probably not do anything, because the type of mediators in allergies are different from the prostaglandins. So basically, just remember that non-steroidal anti-inflammatories are basically going to block the production of prostaglandins. So with this preliminary introduction out of the way, let's look at what they did in this study. As the title says, they wanted to evaluate the value of a new inflammation model in the cat, which will allow to predict the dose regimens of meloxicam when the animal has an acute inflammation. Now today the models of inflammation must meet certain criteria, like providing clinically relevant endpoints. For example, mice are not really good models because they cannot really, you cannot really evaluate lameness. This is obviously not a problem when if we use cats or dogs. The models need to be reversible so that the animal can be rehabilitated and obviously not euthanized. And in the case of dogs and cats, ideally you want to give them out for adoption. The inflammation should also be sustained for several days so that you can evaluate the effect of anti-inflammatory drugs. Obviously they need to be reproducible, and the species should allow for blood sampling so that you can draw plasma profiles of the drug, and that way relate the effects with the concentration of the drugs in the body. And actually they found the perfect model in a substance called kaolin. This substance is inert, and when you inject it in the cat's paw, as we will see, is going to cause a reversible inflammation for 5 days. And that inflammation is going to be actually constant or sustained for 2 days, between 2 and the second day after the injection. And that way you can inject the anti-inflammatory drug on day 2 and evaluate the effect on that inflammatory response for at least 2 days. And after that, the body is going to reabsorb that substance, and it will actually not leave any traces or chronic effects like if nothing ever happened, so to speak. Now, what are the endpoints of the inflammation that they need to evaluate? Well, as we already talked about in the first slide, they want to check for the antipyretic effects. Those are the effects on obviously the body temperature and the local temperature. The swelling, which is how much edema there is on that paw. The analgesia, which refers to how much pain relief is being provided by the meloxicam. They will measure basically 2 variables, which are the pain score and the locomotion. And finally, the loss of function, for which they are going to measure the locomotion and the lameness score. And as you can see here, the locomotion is really a hybrid of pain and loss of functional by the edema of that paw. If that leg is really swollen, it may not be able to, the animal will not be able to walk normally, and that kind of makes sense. So the way they evaluated pain is by the time the cat took to withdraw its paw after the stimulation with a radiant heat, which is emitted by an analgesia meter. Basically, you slide that test heat under the cat so that you align the heat source and you guide the light with the angle mirror to the paw of the cat, which is obviously confined in one of those glass chambers, which is adapted to the size of the cat. And the radiant heat is delivered as a beam of focused light of a fixed intensity, and the stimulus is usually stopped as soon as the cat withdraws its paw. Now the withdrawal time is then transformed into a pain score according to the equation that we have here, and that equation includes the withdrawal time after the meloxicam injection, the time shortly before the injection of meloxicam, and obviously the time before the kaolin injection was ever given, which would be like the control time, if you like. As you can see, they also scored for lameness based on a numerical rating scale, and they also took another endpoint, which was locomotion, and that was quantified as the time required it took to perform a series of tests, which I would imagine were going up and down the staircase here. But they also mentioned creeping under a grid, and they also used an equation which was kind of similar as before, and they expressed those results as a percentage. Now the temperatures were measured with an infrared thermometer for the skin, and they also took whole body temperatures by rectal measurements. And finally, the volume of the inflamed paw was measured with a water displacement technique. And I could not really find one for the cat, but you get the idea with this image of a leg in this chamber that is displacing so much water. So if we look at the results, here we can see the changes that take place by the inflammatory response for each one of these outcomes, and what happens to each one of those when we inject meloxicam on the second day, which is indicated with the arrows. If we did not really inject meloxicam, the course of the inflammation would follow its natural course, which is shown by the line with the white dots. And when you inject meloxicam, you can see that each one of those variables goes down, except for the first one on the upper left. So what do we see here? Well, we have the paw volume on the upper left, the skin temperature on the upper right, the lameness score on the lower left, and the body temperature on the lower right. So on day 0, they injected kaolin on the cat's paw, and they created the inflammation that reaches peak on day 2 for most things except for the paw volume that, as you can see, continue to go up. So if you notice, from day 2 until day 4, the inflammation was pretty stable. It didn't really go up and down. And then after day 4, it kind of started to decline on its own. So if we injected meloxicam on day 2, we would be able to see how it behaves when it's not really going up or down. If you look at the body temperature, it had really a very dramatic effect on almost restoring the normal body temperature in just a matter of a few hours. And that effect lasted for almost 24 hours. And it also had a very strong effect, and a very rapid one, on diminishing the lameness score on that cat. It didn't really go down all the way down to 0, as you can see, but it almost did. And as you can see, the effect was lasted for more than 24 hours. Now, if we look at the effect on the local temperature, this wasn't really as great as it did on the whole body temperature. It really didn't go down very much compared to, as I say, to the whole body temperature. And if we look at the effect on the paw volume, there wasn't really any effect whatsoever. In other words, the edema stayed the same. Now let's look at the other two outcomes, which were the locomotion and the pain score. The cat was not really able to gain its normal function or speed going up and down those stairs, but there was a very substantial or partial gain of the locomotion, and it remained that way for more than 24 hours. And as you can see, it did really not go up again where it was when they injected meloxicam on the second day, which is really a good thing. What's really interesting, if we look at the pain score, is that it did something completely different from the other endpoints when we injected meloxicam. If you look at the scale, when we injected meloxicam, it decreased the pain below the baseline that was supposed to have when there was no inflammation. In other words, it created what they call a hypoalgesic effect, which lasted for more than 24 hours, and the peak effect took place at 5 hours after the injection. This is actually very important and has a practical side, because when you plan on doing surgery, you need to provide analgesia before you start doing whatever incision on those tissues. And actually, non-steroidal anti-inflammatories are too slow to provide that analgesic effect. And this type of studies are actually a perfect proof that they do not work immediately. They take several hours to kick in. So if we measure the difference between the peak, which as you can see is at about 80%, and the maximal effect, which was achieved at about minus 160, the overall effect or decrease would be about 240. So basically, we are actually getting more than 100% pain relief altogether. We could also say that meloxicam is actually increasing the pain threshold in normal tissues, but actually that would require a different type of studies. Nonetheless, as I say, we cannot really reach that conclusion from this type of a study. Now let's try to wrap up everything. I made this graph with some of the data from the paper, and I can tell you I not really quite understand most of it, but I think one of their main objectives was to find the efficacy, the potency, and the sensitivity of meloxicam for each one of those endpoints. So on the y-axis we have the efficacy, which is expressed as a percentage. If you reach 100%, it means that meloxicam will be able to totally restore that endpoint to its baseline value. So for example, for body temperature, if you have a fever and you treat it with meloxicam, it will totally go away. So in that respect, we can say that meloxicam is very efficient when it comes down to providing antipyretic effect. As you can see, you can totally neutralize a fever because you reach 100% efficacy. Meloxicam, with this type of model and the way they scored pain, they could get a value that was below baseline. So that explains why they got a value of more than 100% for pain score. In other words, they explain that as a hypoalgesic effect of meloxicam. And as you can see here, meloxicam was not able to neutralize or achieve 100% efficacy for really any of the other endpoints. Now, the other pharmacodynamic parameter they were interested was potency. And this is at what concentration of meloxicam in blood do I attain a certain clinical effect. So as you can see here, they needed to lower concentrations of meloxicam to have an effect on body temperature compared to any of the other endpoints. Obviously, that's why they needed to collect blood samples from the cats at any time. At the same time, they were doing all the clinical measurements. And the final pharmacodynamic parameter was sensitivity, and that's basically the slope of those curves, and that basically tells you what range of concentrations they were getting an effect for any particular endpoint. So when you get to the end of this type of papers, basically, even if they were only given one dose at a time to these cats, they were able to predict what will happen when they give different doses for each one of those endpoints, and that we're looking. For example, in these two graphs, they were simulating what will happen to the body temperature and the pain score when they deliver a dose of meloxicam going from 0.1 milligrams per kilogram all the way up to 1 milligram per kilogram in a 24-hour period. Having said that, there are other considerations that you should probably take into account, which were the side effects of giving too much of a dose, which were not obviously addressed here. And I can tell you that meloxicam is one of those drugs that doesn't have a really wide margin of safety, so you have to be careful about it. At the same time, I can tell you that meloxicam at low doses is one of those drugs, and you can remember this if you want for the rest of your life. At the moment, is one of those non-steroidal anti-inflammatory drugs which is being used chronically for cats with osteoarthritis. And it has really been shown that it improves their well-being. They jump more, they show more willingness to jump, they show a decrease in stiffness, an increase in activity soon after they get started on the medication. So it has a lot of advantages compared to other non-steroidals for chronic cases. Now, I don't want to overwhelm you with information. This is kind of the final table that summarizes everything in this study, because it kind of tells you what dose, at what dose you will attain a given effect. and that given effect is the maximum response for each one of those endpoints that we were looking. This is what they have on the right part of this table, and on the left part of the table, what they have is kind of what I showed you on the graph earlier. What you would basically is what would be the maximum response that would be attained for each endpoint at each one of those concentrations. So this is kind of my final slide of this presentation. I wanted to introduce you to one of the main categories of drugs that are used in veterinary medicine, and basically to show you the type of studies that are done, which are kind of a combination of a pharmacokinetic and pharmacodynamic models, which are essential to know which dosage will be needed to administer, and when we need to select a particular drug to a given animal. So thanks for watching this video, and until next time, take care. Bye bye.